October is Breast Cancer Awareness Month. Now, after skin cancer, it is the most common cancer diagnosed in women in the United States and is still one of the deadliest. Joining us now from Catholic Health's Mercy Hospital with important information on detecting and treating breast cancer, Dr. Lynette Mendoza. Doctor, thank you for joining us.
Hi, good morning. Thank you for having me.
I don't want to assume that everybody knows what I want you to start right at the basics, like as if I'm a patient walking into your office. Just give me the overview and the facts that you would tell a patient walking in about breast cancer.
So, like you actually introduced, it is unfortunately the most common breast cancer we see in women and still remains to be the deadliest. With that said, I think one of the most important things we try to at least tell most of our patients coming in is that nowadays, it's so important to try to do every breast risk assessment while we can to really capture and stratify women in terms of where they fall for risk. The biggest question I think most patients will have is, when should I begin? We usually go by the NCCN guidelines, which is the National Comprehensive Cancer Network. There are many other, such as the radiology, gynecologists, all accredited programs. And I would say for now, many of us are still recommending screenings to start at the age of 40. One of the other exceptions to this rule is when you have a primary relative who has been diagnosed with breast cancer. We would then kind of change it. I think on the American Cancer Society's recommendation guidelines, they would say less than 5 years earlier from when that primary relative was actually diagnosed, or 40, whichever one would come first. We actually used to have a rule. It was actually 10 years prior to when your primary relative was actually diagnosed. So for example, if they were diagnosed at the age of 40, we would recommend for screening to begin at 30. And that being said, under the age of 30, if there is anything that a woman presents with a problem in the breast, we would always start off with our sonography, ultrasound, and then from there we would go as to completing the workup if there was anything else that was needed.
Screening, we keep talking about screening and just how important it is to catch breast cancer early, because very often there are no symptoms with breast cancer, right?
That's correct. In many cases, it's funny that you say that because we have so many patients, but it's not just patients. I think even healthcare professionals also question whenever there are symptoms specifically that are pain associated. I think as more and more of our screenings and we've come out to really try to get the public to be aware of certain factors, pain typically is associated with things that fall in the benign category. And really the pain less is more commonly associated with, yes, cancer. And so what we try to detect, or what we try to counsel women, is really the main things. You are the best historian of yourself. And so you see yourself every single day. And so, that's what we're going by in terms of like when a patient comes in to present and having that kind of history and working the patient up. Similarly, when you're at home and you're trying to figure out what should I check for, always skin changes, things that are new that did not happen or feel like that prior to, nipple discharge, or anything palpable that really isn't symmetrical. Those are the things that when you come in, we want to hear about and we want to learn a little bit more. Imaging is quintessential, though, to really completing an evaluation, as wonderful as we think we are with our examinations. Obviously, putting the whole picture together with imaging is crucial to really have a conclusive evaluation and diagnosis for patients.
And those screenings and the imaging getting better and better every year. And that's leading also, that it goes with better treatments. So you are seeing more women survive breast cancer if caught early, right?
That's correct. So it's kind of a multifactorial component in that we have, like you said, so much better, technology has improved drastically, and the modalities that we can obviously work up patients has really helped. In addition to that, the treatments from a surgical perspective, which is where I can come from, there are many options now that we can offer patients in terms of something that's breast conserving versus something that does require mastectomy and reconstruction options. interestingly enough, as we can offer more and more options in terms of reconstruction to patients, it's interesting that now more patients are feeling comfortable and confident in actually not even pursuing reconstruction. But again, moving forward with technology and all the things that we can offer patients, this has really tremendously helped a lot in terms of patients and morale, and really putting the word out there for other patients. In terms of medical oncology, that too, I would say actually in 2020, we came out with two new regimens that really changed the game for patients and their treatment in terms of overall survival and even recurrence. So yeah, a lot of new exciting things. And in this specialty, I think one of the most rewarding things is that quickly things change. There's so much research going on, and I think that's one of the most satisfying things is when you put it into practice and really make a difference.
This is, as I said, Breast Cancer Awareness Month. What are you doing at Catholic Health to raise awareness this month?
Well, actually, all of our hospitals are doing an amazing job. We're putting together, this is just some of the things we had actually yesterday. We had a little bit, this is our team here at Mercy. And at all of the other hospital sites as well, we're doing a little bit of something. We're also trying to do little lunch and learns. We're doing breakfast, anything for patient awareness, and really to just get the word out, to come get your screening. It's so important. The more information you know, the more empowering it is. And that's one of the biggest things I could tell women is knowledge is power, and get to know yourself and start first with your health. And you could just really make a difference to not only yourself, but to other women as well.
The power of that color pink. I know I drive by Good Samaritan Hospital and the pink flags are all outside, and it reminds you it's Breast Cancer Awareness Month. Get checked. Dr. Mendoza, thank you so much for joining us today. Great information.